everybody, it's Dr. Joe, and today I'm going to show you a seated knee to chest stretch. So let's get started. Disclaimer alert, disclaimer alert. So if you haven't subscribed already, make sure and click on the button down there. This stretch is a part of my office stretching series. It's all real-time stretches. It goes from head to toe. So if you want to check out some other stretches, make sure and click on the link up there. So the seated knee to chest stretch can be done lying down, but if you're in an office, if you're sitting in a chair or doing something like that, you can easily do the stretch in the chair as well. So I've got my timer set for 30 seconds. We're going to do 3 on each side with a little 10-second break in between. So I'm going to go ahead and start the timer, and then I'll talk you through the stretches as we go. So with the knee to chest stretch, all you're going to do is just bring your knee up towards your chest. So it's just how it sounds. The key is don't bring your body forward, bring your knee up towards your chest. If you can't bring it as high as mine, that's fine. You know, if you can only bring it to here and you're starting to feel a stretch, that's completely okay. If you have some knee issues, instead of holding it like this, you might want to grab underneath and pull it up. I tell my patients to do that a lot, but if you don't really have any knee issues, sometimes you can get a better pull when you're pulling on the outside versus the inside, but make sure you don't end up irritating your knee by doing this stretch. But when you stretch and you're pulling up, you should feel a little stretch in your bottom area and your low back. That's where you're trying to stretch. Some people feel a little pinching in their groin area, so if you're feeling that little bit of a pinching, either bring your hip out a little bit with your knee, or just don't pull up as high, because again, you don't want to be pinching something and get it hurting while you're trying to stretch something else out. But if you're not feeling that pinch in there, just give it a nice pull and get that stretch as much as you can. And then take that little break in between. So make sure that if you're sitting at a desk, move out a little bit so you don't bang that knee into the desk, but just get that nice little pull. I like having the outside hand up on top and the inside on the bottom. I just feel like that's more comfortable for me. Again, you can kind of just hold it this way if you want to, as long as you don't have any finger issues or knee issues. But again, if you have some knee pain already, just go ahead and grab underneath and pull up, and you're still going to get the same benefit by holding up that stretch this way. But again, don't curl down and stretch like that. Keep your back nice and straight and relaxed, because anytime you're stretching something, you really want your whole body to be fairly relaxed. So if you're tensing up other muscles to try and do it, then you're kind of defeating the whole point. So if this is hard and you're having a hard time pulling that knee up, then you can definitely do this lying down, which might be a little more comfortable for people. You just might want to wait till you get home to do it, and you can check out some of my other videos to be able to do it on the ground at home, or even on your bed. If you don't want to lie on the ground, or if it's too hard to get up, you can do it lying on your bed or on the couch as well. So lots of different places to try it, lots of different positions to try it, but just getting that nice stretch in there. And again, you should feel it kind of in that low back area, kind of in the bottom area, getting a good stretch in there. And then again, pulling up. Some people ask about the foot. Should it be pulled up? Should it be pointed down? Should it be relaxed? Kind of goes back to the same thing that I was talking about when you're stretching. I really feel like you should be relaxed. So some people might feel more of a stretch if they're pulling their toes up, but then again, you're activating muscles, and the point of a stretch is to get those muscles nice and elongated and stretched out. So if you're contracting something, sometimes you're defeating that point just a little bit. So again, just taking a little rest break in between. Sometimes if you're on a harder chair versus a softer chair, it might, make it a little bit harder or easier depending on what kind of chair surface you're on. But if it's a little bit harder, it might be easier to get the stretch, but you might have a little more pressure on the sit bone. So just make sure you're comfortable again while you're doing it, because you don't want to irritate anything down there while you're doing the stretch. And again, if you feel like you're getting a lot of pressure on that knee, you can even kind of bring it out a little bit, because you're really focusing on pulling this part up. But again, if you want to get that knee in there too, then you can do that as well. So those were your knee to chest stretches in a seated position. And again, this is part of that office series where I go from head to toe, a whole bunch of different stretches, and it's in real time, which I know a lot of you like. So check out the link up there to find out all the other ones. And if you'd like to help support my channel, click on the link up here to find out how. And of course, don't forget to subscribe by clicking down here. So remember, be safe, have fun, and I hope you feel better soon.